For many of us, your record has been as very extreme on abortion issues. Other pro-life groups, have put a lot of information out there that basically you've been against pro-life on the record. Also, some issues with religious liberty manifesting itself in where you actually took to court Little Sisters of the Poor. I'm not going to go into the detail of that. I think that says enough. But I do want to ask you this question: if you're, get through the proceedings intact, and you are the HHS secretary, you're going to be representing everyone. And this is a very succinct question to the point. Will you commit to not using taxpayer money to fund abortions and abortion providers?
Senator, if I first can start by saying thank you very much for the lengthy conversation we had. I definitely appreciate it. And while we probably will not agree on all the issues, I can say to you that we will definitely follow the law when it comes to the use of federal resources. And so I can make that commitment that we will follow the law.
Not really the particular answer I was looking for, but I'll take that because I want to move on to the next question. Operation Warp Speed. I'll never forget in the early discussions we had with the FDA, CDC, there was squabbling within the bureaucracies about how we were going to get this effort made that we all knew even at that time, with the peculiarity of the disease, that was going to be the real light at the end of the tunnel. Being an entrepreneur, knowing how the business world works, knowing that pharma has been so stodgy with its record in terms of coming to the forefront with new cures and so forth, mostly impeded by some of the regulatory impediments. Will you acknowledge that that was probably the most important variable in this whole tough journey with COVID-19, that we broke the paradigm of how things normally work by galvanizing, pharma to come up with vaccines that took basically 1/4 to 1/5 the time, predicted before?
Senator, let me agree with you that had it not been that we essentially knocked some heads and said everybody's got to come to the table, and it had to be the private sector working with our government and our local leaders, we probably wouldn't have had that success. And so we've learned from COVID. FDA has learned, I hope FDA, and if I'm fortunate to be confirmed, I'll make sure they've learned that we can do things with a fast pace and still ensure safety. So I think the gist of what you're asking is something that I agree with, and that is that we should take the lessons that we got from COVID so we can do this faster and smarter and safer the next time.
Would it be a stretch then for you to say that you can give that credit to the Trump administration?
Certainly they worked on very hard, and it was a whole of government along with the private sector response, and there are a lot of people to thank. But without the work that the previous administration did, we would certainly not be here.
Good. Now let's get to the part we spent most of our discussion on, and that I, as the most vocal Senate Republican, have said since I've been here, the healthcare system is broken. Anything that costs twice as much as what it does elsewhere, delivering results that I know we have some things that are stellar, but generally not good. We had a robust discussion about whether you want to throw more government into a broken system. And here, I think there would be Republican support if you're embracing the thing most popular next to term limits. That means it's up there around 90%. Healthcare transparency across the board. And before you answer, I notice that you're supported by the American Hospital Association, American Medical Association, 55 to 60% the cost of our broken healthcare system. Association of Health Insurance Plans. The only one missing is pharma, and I think I know why. Tell me that you would be there to push healthcare transparency to fix the system before you throw more government at it.
And Senator, here I want to thank you for the work that you've done on this issue, and quite honestly that Congress has done to try to move us forward. American people are entitled to know what they're buying, and especially if it's a life or death situation. And so what I can say to you is that we will do robust enforcement to make sure that price transparency is there for all Americans, because for far too long, people have never had an idea of what they're going to pay if they walk into a hospital.
Thank you.
Thank you.